Hi, I'm Ryan Nutter, CEO and Principal of Cornerstone Senior Advisors, and in this video I want to discuss with you the good and the bad of Medicare Advantage plans. There are real benefits with Medicare Advantage, there's also some downside to Medicare Advantage, and I want to just shortly dialogue on what those are with you. But before we get into that, let's just talk about what Medicare Advantage is. When you sign up with a Medicare Advantage plan, they basically call them a different way to receive your Medicare benefits. So what happens when you sign up with a Medicare Advantage plan is the government is going to hand responsibility for your health care off to a private insurance company. Whatever company you sign up with, they are now administering your health care. Well, because the government is no longer responsible for your claims, they're subsidizing that company that you've signed up with every month you have that plan. They're receiving subsidy from the government. So the government's basically rolling the dice saying in the long run, we're going to save money because we don't have to pay for your claims anymore. Also, when you sign up with a Medicare Advantage plan, you still pay your Part B premium, which in 2023 is $164.90. That premium varies year to year. In 2023, which is when we're recording this video, it's $164.90. You still pay that premium, but the government's also going to send that to the carrier that you've signed up with that's offering that Medicare Advantage plan. So they receive a subsidy from the government plus your Part B premium. Because they receive those, the Medicare Advantage plans that are available oftentimes are zero premium. They don't charge you any additional premium above and beyond that $164.90, which is your Part B premium. That's the first good. That's the first benefit, is they're very inexpensive. Sometimes they offer a little bit of premium, but if they do, it's pretty minimal. So that's the first benefit, is they are very cheap, oftentimes zero premium. Now, the amount of subsidy that the government has been sending these companies, the last several years it's amped up, they've increased it each year, so the benefits with these plans have also increased. A lot of these Medicare Advantage policies are offering things like dental insurance, like vision insurance. They'll help you pay for a new pair of glasses. They'll help cover some hearing aids. These are all things that original Medicare do not cover. They don't offer coverage for dental, vision, hearing. They're also going to offer oftentimes over-the-counter benefit, where they will give you a certain amount each month or maybe every 3 months that you can spend on over-the-counter items like Tylenol, ibuprofen, vitamins, Band-Aids, knee braces even, so on and so forth. Something a lot of people like with these Advantage plans is gym memberships. You get free access to a lot of the gyms across the US. So there's some real benefits. Those are all good things that Medicare Advantage offers. A lot of Medicare Advantage plans also come with a Part D drug plan included in the Medicare Advantage policy that you don't have to pay a premium for. When you go with Medicare and a supplement, you have to find and pay a premium for a standalone drug plan. A lot of these Medicare Advantage plans, if you get a Medicare Advantage plan that comes with a drug plan, it just has that built into the plan. You don't have to pay any added premium for it, and it's going to help you cover your medications. Well, that's another good part of Medicare Advantage. I do want to throw a disclaimer out there. You can't pick and choose drug plans when you sign up with a Medicare Advantage plan. So whatever Advantage plan you sign up with, whatever drug coverage they offer, that's what you get. So before you enroll in the Advantage plan, make sure it's going to cover your medications well. That's something we will help you with when you call our office. Those are all good things with Medicare Advantage. They are cheaper, oftentimes zero premium. They can cover things like dental, vision, and hearing, over-the-counter benefits, gym membership, coming with drug coverage that you don't have to pay an extra premium for. Those are all real perks. But there are also some downsides to Medicare Advantage. Number one, they're network plans. So when you sign up with a Medicare Advantage plan, you want to make sure any healthcare provider that you use in a given year, or even who you might use in a year, would accept that plan because they are network plans. Network is something that you need to pay attention to. Now, some of these companies that offer Advantage plans have begun to network share. And so what that means is if you sign up with a Medicare Advantage plan in Wichita, Kansas, and you travel to Orlando, Florida, but that company you have also has a network in Orlando, Florida, well, you can go to an in-network provider in Orlando, Florida, and they'll just treat you like you're in-network. You don't have to stay in the Wichita, Kansas network to be covered. But they are network plans. Not every healthcare provider are going to take the Medicare Advantage plans that are offered in your area. So that's something to pay attention to and be on top of when picking a Medicare Advantage plan, making sure that that network works with your providers. Maybe one of the biggest disadvantages with Medicare Advantage goes back to the government's handing all responsibility for your healthcare off to a private insurance company. And so what that means is if a doctor or a healthcare professional wants to prescribe any procedure or test, they have to get the green light from whatever Advantage plan you've signed up with before they can proceed. Sometimes that can be an issue and really frustrate people. Let's say your doctor wants to order you a stress test. Well, an Advantage company may come back and deny that request, but say we'll approve an EKG instead. I'm not saying this will always happen. I'm saying sometimes it does happen. There are many people that have Medicare Advantage plans and really like them. When people have bad taste in their mouth about Medicare Advantage, it often goes back to situations like this. Let's talk about skilled nursing for a second because this comes up often with Medicare Advantage plans. You can stay in a skilled nursing facility as long as you're showing improvement. A Medicare Advantage plan, if you are admitted to a skilled nursing facility, well, they'll pay 100% up to 20 days in a skilled nursing facility, but they are going to look at that healthcare provider's notes as long as you're there every couple days. The rule of thumb with skilled nursing facilities is you can stay in there as long as you're showing improvement. If they decide you're not showing improvement, they're going to tell you you need to go home. They might still send physical therapy, speech therapy, occupational therapy to your house to work with you in recovery, but they're not going to let you stay in the skilled nursing facility, which can be frustrating. If you had a life event like a stroke and you're not able to do daily living activities on your own yet, but they're not seeing any improvement, well, they may send you home, but you're not able to do things like eating, bathing, dressing on your own. So you have to find somebody that will help you with that. And that can put you in somewhat of a predicament. So that's some of the downside with these Medicare Advantage plans. They've become very popular over the years. And last year in 2022, 49% of new Medicare beneficiaries signed up with a Medicare Advantage plan. I think there's a real place for them, but there are positives to Medicare Advantage and there's negatives, like we've just discussed. These are all things to weigh and consider when you're trying to decide to figure out which health insurance you want to sign up with. I always tell people health insurance is a peace of mind. It's something that you have in place in case you need it, and you just hope you never have to use it. So when you're looking at your options, whether you go Medicare with a supplement or you would go with a Medicare Advantage plan, what's going to give you more of a peace of mind? Do you like the idea of not having a network, paying extra monthly premium, and not having to worry about a health insurance company dictating your care or out-of-pocket exposure? Well, then go with Medicare with a supplement. If what's going to keep you up at night is having to pay all that monthly premium and you're okay with some of the copays and the network doesn't bother you, then go with a Medicare Advantage plan. And you like the idea of all the perks with the dental and the vision and the gym membership, go with Medicare Advantage plan. You have good options, but it's good to know the good and the bad of each plan before you pull the trigger and sign up with them. I hope this information was helpful for you. If you have questions, please give us a call, 316-260-3331. We'd be more than happy to address any questions and concerns that you may have. Also, if you'd like a free copy of my book, Medicare Made Simple, give us a call. We'll ship it out to you. You don't have to pay us a dime for it. We'll break down Medicare Advantage plans, supplemental plans, drug plans, the ins and outs of Medicare, and try to simplify all of Medicare for you so you can make an intelligent and an informed decision that you feel confident in. Give us a call today, 316-260-3331. We'd be more than happy to help. I hope this video was helpful for you, and thanks for watching.